Hi, everyone. Nice to see you tuning in for this special live event with Dr. John McDougall, MD. This is a talk that Dr. McDougall's never done before, so great to see you, Dad. I can't wait to hear this.
Thank you. I started on this talk in June of 2022, and I've been working on it since then. It hasn't been a matter of me not being ready to give it. It's just, I guess the audience wasn't ready to receive it, because I think you're going to find this a life changer. At least I plan on delivering it that way. We'll see how it goes. Who knows? But I'll do the best I can. I'm excited about sharing this with you. This is about how we interact with other people. It's going to be a discussion in two areas of interaction, and I want to make sure you understand that we're going to be talking about a couple of different areas of our lives. One is our professional life, dealing with school, our business, our community, friends and family, and so on. In other words, people we have a platonic relationship with. We want to enhance those relationships. We want people to like us. We want to be attractive so that we can succeed more in our business life and that part of our social life. And that we're going to be talking about a lot. And everything I'm telling you about interplays in the platonic relationships, whether it's obvious or not. And the other area that I'm going to deal with is about our reproductive life, our sexual interests, and how we're attracted to each other so that we can continue the species. And you don't have to combine one with the other if you don't want, but they interact so closely. And what I share with you about one applies to the other. In fact, I can't imagine you not wanting to introduce these ideas every place in your life. You want to be liked. You want people to be attracted to you. You want to appear at your best. You want to be the best person you could possibly be. And I'm going to see if I can share some ideas with you.
Well, Dad, I know we all want to look and feel our best, so, and I know
We do.
food and lifestyle is a huge part of that.
Even when you're a little kid, even little kids want to look good. So are we up and running, Heather?
Yes, looks great.
All right. Well, this is going to be a presentation you can watch later on because, of course, we're recording it. All right. So let's get started. Let's talk about the most important thing for us to understand is health is attractive. I know you think it's the clothes you're wearing, it's how you put on your makeup this morning, it's the right pair of shoes you picked out, it's the car you're driving. No, what people are looking at is health. That's how you're attracted to other people, not the shape of your nose or the height of your cheekbones. It is people recognizing that you're a healthy person because we want to surround ourselves with healthy person because of platonic issues and sexual relationships. Both need to be successful. There's some things about ourselves that we can't change. Like we're getting older. And, youth is attractive. Why? Because in youth, people are healthiest. So they really go together, don't they? But as you get older, you age, and that's usually associated with less attractiveness. That's my observation anyways. Can you do anything about it? Yeah, you can change the way you age, but not much, not in terms of years. We're all kind of destined to a lifespan that's normal for human beings. Other things you can't change are gifts that you were given because of your genetics. Maybe the position of your eyes or your nose or the height you are or the size of your various body parts. There are some things that are passed on in terms of our heredity, which we have no control over. And we're kind of stuck with these for life. So you're not going to be able to change those. We try, don't we try? Look at all the things that we do to cover up our unsightliness. We buy expensive cars, we go to the beauty shops, the salons, have plastic surgery, buy all kinds of, spend thousands of dollars on our clothes, jewelry, tens of thousands of dollars, all kinds of perfumes and deodorants and so on to cover up the unsightliness. But your health shines through this. This is like putting lipstick on a pig. You can't cover up your true nature as to whether you're healthy or not. So although you may want to take advantage of these superficial cover-ups, it doesn't make a lot of sense to me to ignore the most important source of your beauty, which is you, and enhancing yourself to the best you can be. And then we can go about dolling ourselves up with fancy cars and jewelry and clothes, et cetera. But don't miss the underlying most important basic issue. And that is, what is attractive? Health. We're going to be talking about two types of relationships, as I mentioned in the beginning. And I want to make sure it's clear because I don't want anybody to be put off by, well, he's not talking to me. Yeah, I am talking to you. I'm talking to you about advancement in your education, your businesses, your family life in terms of usual interactive family relationships. And then I'm going to talk about another area, and that's the close relationship that results in your family, offspring, your reproductive. This is a really important part of your life to pass on the species and your family members. When it comes to platonic relationships, getting along at the office, at the church meetings, et cetera, there are things that you are advantaged by being attractive. I mean, attractive people end up having, more opportunities, more gifts in life because they are healthy. The favors for being healthy are things like everyone around you adores you because slim is something that we admire, and overweight is deplorable. It extends into our legal issues. There's some pretty famous cases recently of beauty versus not so beautiful in terms of who won out. The most attractive person, right? You're judged to be competent as whether you look healthy or not, whether you have good home habits or work habits. And anyway, whether you're a good parent or not is often judged by how healthy you look. It favors health in terms of your employment. Overweight people, diabetics, make less money than somebody who is trim and healthy. You have a better chance of being hired if you are healthy looking. You're deemed to have better work habits. You're considered more qualified. You'll be rewarded with a higher salary and promotions and job evaluations. I mean, you're going to succeed in the business place. Why? Because the people who are around you want to have healthy people working with them, because healthy people are more likely to get the job done and more efficiently and to show up for work. So there's a great drive for surrounding yourself with healthy people in your business relationships. And education, whether or not you get an education depends upon how healthy you look, or at least your opportunities, whether you're accepted to a university or the kind of college university you get into as far as its competitive nature and its reputation. Just looking good, healthy, looking good. You have a better chance of getting higher grades as somebody who does the same amount of work and isn't so healthy looking. It'll advantage you so many ways in your life to be healthy in these platonic relationships. And when it comes to a worldwide picture, I mean, think about what's going on in the world today. We have a world marketplace. And we in the United States and in Western Europe, we're competing against Asians, primarily, people from the Indian continent. And up until recently, both these populations have thrived on a starch-based diet. And as a result, people in Asia or in the continent of India, they're more productive. They're younger looking, more active looking, healthier looking, and they produce at an efficiency that scares a lot of business people in the United States and Europe because they're starch eaters. They're more likely to succeed, and because they're starch eaters, they're much healthier and can produce. Let's talk a little bit about reproductive relationships. Attractiveness is a signpost for your sexual performance. And the goal is to pick a mate that is healthy so you can have the best offspring possible by sharing your sperm and eggs together. That's what you want to have, is you want to have the best family possible. And that means picking a healthy mate. When it comes to men, if you eat a healthy diet, a starch-based diet as opposed to a meat and dairy-laden diet, you're much more capable of doing your job as far as sharing your genetic material. You have a higher sperm count. Your sperm are much more active, lively, mobile, and there's less genetic damage if you eat a healthy diet, a starch-based diet, as opposed to the typical American diet. As a man, you have a higher risk of producing an offspring that has Down syndrome, trisomy 21, which is it's a devastation. Well, some people consider it a blessing, but I'm not here to get into that. But preferably, I think most people would not want to have this blessing added to their family. Well, whether or not you have this gene abnormality, aneuploidy it's called, depends upon your folic acid intake. No, not folic acid, folate. Yeah, folic acid is the form of the vitamin B9 that comes in a pill, in a bottle, in a potion. That's folic acid. Folate is the form of this particular necessary vitamin, that is found in plants. Now, if you have as a man, a diet that's low in plant foods, folate, foliage, plants, you understand that. If you have a diet that's low in plant foods, you have an increased risk of having genetic problems with your sperm that lead to the combination that results in Down syndrome. Now, as far as a woman concerned, her problems with plant deficiency, folate deficiency, which has been supplemented with folic acid supplementation, is she has a higher risk of having a very serious malformations in her offspring. These are called neural tube defects. The neural tube is like from the brain all the way down the spinal column. Neural tube defects. And actually, I was a student in attendance during medical school where on 2 occasions, the women gave birth to babies without a brain, just had a face. And I've been on dozens of births and seen children who've had their spinal cord left open and their paraplegia. It is a disaster to have this happen. Well, it's well recognized by the scientific community. This is due to, well, we could say folic acid deficiency, because what they recommend is that you take pills. Not just when you're pregnant, but you have to take them long before you're pregnant, because the deformities occur before you even know you're pregnant. So you got to start, when you begin your reproductive years, you got to start supplementing with folic acid. That doesn't sound normal or natural, does it? Well, when you realize that folic acid is the pill form, and we're not designed to take pills, whereas folate is from plants. So what we're talking about is that a young woman, a middle-aged woman, older woman, etc., should be on a high folate diet during her entire life, not just during the reproductive years, to prevent these serious neural tube defects. Lack of folic acid, lack of plants. What we've done in various societies like the United States and England is we've supplemented our food, like our flours and our cereals and our breads and many other products. We supplement them with a vitamin pill, folic acid, so that we can get young people or people prior to reproductive years or reproductive actions, we can get them on this supplementation by feeding them cereals that are laced with a vitamin pill. One of the problems here is that the same dose that prevents neural tube defects increases the risk of dying of heart disease for the general population. Yeah, did you hear that? You may have less neural tube defects in your pregnancies, but the general population, as a consequence of this worldwide supplementation of our food supply with folic acid, has an increased risk of dying of heart disease at those levels. How do you solve this dilemma? You get your folate from plants. Birth defects are caused by environmental chemicals. This is a huge source of damage, all the way from cancers to birth defects. Neurologic damage, all kinds of things occur as a consequence of these chemicals. Well, realize that when you eat the Western diet, you've taken the highest concentration of these chemicals because of a process known as biomagnification. Bioaccumulation is what occurs. Pollutants that are sprayed on our grasses and grains and seaweeds and so on are consumed by lower on the food chain animals, like the fish or the cow. And they take in just pounds and pounds and pounds of these environmental chemicals, which are sucked up into the body fat. Sucked up into the body fat because these are fat-soluble chemicals. So they move from the plants, concentrated hundreds-fold, up into, say, a fish, a vegetarian fish, and then a carnivorous fish comes along and eats the vegetarian fish. And then so on and so on and so on. So you have the pelagic fish, the tuna and the sharks and so on, who are on top of the food chain. That's why we don't eat these things, because they're so full of environmental chemicals, particularly methylmercury, which is a very serious toxin. Same thing happens on land animals. You go from grasses and grains to cows, and then what happens is people eat the cows, and then at the end of the food chain, who gets the highest concentration of these chemicals? It's baby sucking off a mother's breast. Overweight, unhealthy people are less fertile in general. If you're healthy, you have a bigger family because you have more numbers, more family members. If you're unhealthy and you have a bigger family, it's because they're big in size, because you're less fertile. So that goes for men and women. They're less fertile if they're overweight and are ill. When it comes to men, we have a special problem, and that's delivering our part of the bargain. That requires an erect penis. Unfortunately, the most common cause of erectile dysfunction is closure of the arteries to the penis due to atherosclerosis, due to the Western diet. And so what happens is the arteries that fill up the spongy material in the penis are closed down, and you don't get a good blood flow, and you don't get erection of the spongy material. And erectile dysfunction, they call it the canary in the gold mine, because it may be erectile function today, but it might be a stroke or a heart attack tomorrow. Same diet, it causes both. So men can't perform their part of the reproductive process, often because of this sexual dysfunction, erectile dysfunction. Yeah, men are, well, people in general are designed as plant eaters, herbivores. Now, not just men, but women also. And let's just talk about the male anatomy for a minute. One statement I want to make to you is that seminal vesicles are only present in herbivorous animals. Okay? Meat eaters don't have seminal vesicles. Now, what are seminal vesicles? Down in your pelvis, you have a prostate gland, and you have a couple of sacs. These are called seminal vesicles, where the seminal fluid, the sperm and the other liquids, are mixed up and stored in these seminal vesicles. Well, if you look at the male anatomy, we have seminal vesicles. So we store the ejaculate between events, and then when the time comes, we ejaculate, a decent amount of this seminal fluid, because we have these storage sacs. But carnivorous animals, like cats, for example, they don't have seminal vesicles. We are the only meat-eating animal that has seminal vesicles. So what does that tell you? Well, it tells me we shouldn't be a meat-eating animal. We should be like the other herbivores, cows and horses, etc., that have these seminal vesicles. We are vegan all the way down to our prostate gland. Women, as far as their underperformance in the sexual interaction for reproducing children, they don't do so well. One of the main events is the delivery. in a 9-month pregnancy. You look forward to this and, with some fear and some pleasure. And what happens is too often is these babies just plain simple can't get out. They're stuck in mommy's pelvis. Why? Because the babies grow too big. Why? Because the mothers eat too many calories and too much fat. So the mothers get fat. The average weight gain in an omnivorous woman is 32.46 pounds during 9 months. The average weight gain in a vegan woman is 25.52 pounds. Now, as far as the ultimate outcome, which is if you can't get the baby out through the normal birth canal, you have to take it out through the top. And so you do a cesarean section. Well, what you find is that obese women, 42% of them have to have C-sections. Severely obese, of those who have C-sections, 40% are obese, and severe obesity is suffered by nearly 10% of them. So doctors, we have our terminology, and I look back with a little smile on my face as to what we used to call this. What we should be calling it is the baby's too big to get out the birth canal. That's the problem. I mean, birth canals were designed for 5, 6, 7 pound babies. Babies today are like 10, 12, 14 pounds, maybe 8, but they just plain and simple don't fit. Well, doctors, they have some interesting terms for this. They call it fetal pelvic disproportion or failure to progress in labor. That kind of blames the woman, doesn't it? Or an emergency C-section, that's what they go for. Anyways, our C-section rate should be around 5 to 10% of the population at most should have C-sections due to real needs. But cesarean sections in the U.S. average about 32% of the births. And in places like Brazil, where it's something that the rich people do. They have C-sections. They don't have normal vaginal births. 77% of women undergo C-sections. Anyway, so that you can function at this particular important time during your pregnancy when you deliver, you need to be in tip-top shape, and your baby needs to be the right size. All right, let's get down to the physical activity required to share your genetic material. And the question is, how fit are you? How fit are you to undergo this particular dance? And the title of the dance is Sexual Intercourse. Can you do it? Can you perform? A lot of people can't because they're in such poor health. You're talking about an activity that takes 7 to 13 minutes if it worked out well. 1 to 2 minutes too short, 30 minutes too long, this dance. Heterosexual women, the average time to orgasm is 13.5 minutes. And calories expended. Men, 101 calories per minute, and women, 69 calories per minute. During this active dance, are you fit? Can you do this? Can you perform? During this important time of conception, they call it. Well, if you eat a starch-based diet, you ought to be able to. We know this for thousands of years. Take you back a couple thousand years to Ephesus, which is modern-day Turkey. A couple thousand years ago, it was dominated by the Roman Empire, and they had a lot of sporting events. They were gladiators that fought in Colosseums, and they fought to the death. Well, they found a grave site in Ephesus, and what they uncovered was 55 individuals, and 22 of them were found to be gladiators. And how'd they know they were gladiators? Well, they had trident holes in their heads, and they were buried with swords and shields and tridents. And they analyzed the bones of the gladiators and compared them to the bones of the non-gladiators. You can tell what somebody has eaten as a long-term diet by looking at the mineral content of their bones, particularly the strontium versus calcium content of the bones. And you find a pattern in these gladiators that tells us that these gladiators were vegan. And if you look at the stories of these people, what you find is writers have talked about these very famous stars. These are the rock stars of that time. They were known as the barley men because they lived on a diet of barley and beans. Now, why do they live on a diet of barley and beans? It's because somebody owned them. And they wanted them to perform to their best. And they knew that if you fed a vegan diet of barley and beans, they were more likely to endure and to be strong than if they fed them the typical Roman diet at that time, which was non-vegan. It was bad form to lose in the Colosseum. You wanted to be at your best. And our modern gladiators, the same thing. The winners of our triathlons and our marathons eat a starch-based diet. They look at the winners of New York and Chicago and Honolulu and Boston marathons over the last 3 years. You find they were dominated by Ethiopians and Kenyans. Well, the diet in this part of the world, particularly among these athletes, is a diet of corn. They eat a porridge called ugali. And it's just a mixture of cornmeal and maize, it's called maize, and water, boiled up, served with a few vegetables. And clearly, the people in the sports world know that the reason that these men and women win is because of their diet. I just bring this up just because it's one of my bragging points in life is I had the opportunity to be working with the fastest man in the world back in the 1980s. Carl Lewis set the world record for the 100-meter dash. He did. Won 3 long distance jumps and won records in relays that still stand today. And he was an older man. Well, when I met him at Twin Cities Live in Minneapolis, St. Paul, we to go on a television show, he was complaining to me that he couldn't lose the extra weight he needed to lose to be a winner. You know, just a couple of ounces. And every time he tried a diet to lose these couple of ounces, he lost his endurance, his ability. He couldn't perform as well. So I said, hey, Carl, try this, see what happens. Well, Carl Lewis went on the McDougall diet, and you can listen to the tape recording if you want to go to my website and hear Carl talk about this. The fastest man in the world set these records on the McDougall diet, a starch-based diet. All right, let's talk about 3 major areas of communication. And this is distance sensing is what it's called, distance sensing. We have visual communication. Well, first of all, the receiver has to have good organs. And what we're talking about here is the eyes. And there are just so many diseases caused by the Western diet that prevent you from seeing well, like diabetes, diabetic retinopathy, glaucoma, cataracts, and macular degeneration. They're all a consequence of eating the Western diet. So you want to avoid these so that you can have, you can be a proper receiver of the kind of visual stimulations that will be communicated among people who want to be more attractive. I would say that this clearly, in most people's heads, would not be associated with being attractive. Why? Because he doesn't look healthy, does he? Health is attractive. And obviously you can tell at this extreme that this is a problem. Now, whether being overweight or underweight is attractive or not varies by societies. And we have had times in the past, distant past, several hundred years ago, and I'm sure more often than that, when foods were scarce and it was desirable to put on a little fat because everybody else in the society was so thin. And so the aristocrats, the wealthier people could afford to eat a little bit more rich food and be a little bit fatter. And so we see pictures like this, obviously a little heavier weight than most people would consider to be ideal these days. But this was the ideal at that time. And I want to point out to you the fat accumulation that was so envious and so appreciated was fat accumulation in the buttocks. It's gynecoid fat. Why? Because that's where the food is stored for the infant and for the developing fetus. For the infant during its breastfeeding, its early nutrition. Those calories came from mommy's buttocks. So that's one of the reasons it was desirable. Whereas accumulation of fat, which is android, that's male fat accumulation, is not often, in fact, not as far as I know, appreciated as being attractive. It's the hips. It's the bigger size, which reflects accumulation of more fat. in the area of the buttocks. Now, because of this, we've looked at appreciating the body physique of people, and particularly women. And we've tried to decide which is more important. Or maybe there's a ratio between waist and hips that is ideal. And so, experiments are done where they set up an experiment where they show different pictures, and they have a computer set up, and they have viewers watch the different pictures, and they see where their eyes point to and what they're interested in. And what they've turned out is that, people are interested in a particular portion of hips to waist, or waist to hip ratio of about 0.7. In other words, your waist would be 70% the size of your hips. And that's considered an ideal hip waist ratio or waist hip ratio. But, whether or not you're attracted to somebody, this particular ratio, waist hip ratio, it's important, it's noted, it's studied, and so on. But more important for determining attractiveness has been just how fat somebody is, which is measured by a BMI. That's more of a determination than that ratio I just talked to you about. BMI, body mass index, it represents approximately the amount of body fat you've accumulated. In other words, if you have a BMI of 20%, then 20% of your body mass is fat. 50% of the body mass is fat. This is only just a rough association. So you look at various body mass indexes, which are determined by a formula of weight divided by height squared. There's a formula for it. What you find is it comes out with different numbers, this ratio does. And what's the ideal BMI in a woman is 18.5 to 24.9. That's an ideal BMI. That's when you're most attractive. For men, turns out to be about, ideal would be maybe 10, 20% for men. Anyway, I think just eyeballing the situation and taking a look at somebody's physical appearance will give you enough information. On the McDougall diet, we are very proud of our sustained weight loss, a permanent weight loss, not just initially. Initially, the average weight loss, we're looking at 1,700 people. The average weight loss in 7 days is 3.1 pounds, eating as much as they want, enjoying the food. When I say it's permanent, I'm talking about 2 additional studies that are done on our program. And this is a study done at Oregon Health and Science University, which is 1 year. That's the medical school in Portland. What they found was the average weight loss in 1 year. I mean, if you do something for 6 months, it's permanent. 1 year was nearly 20 pounds. And a study done in New Zealand, independent of us, showed that the average weight loss in a year was 25 pounds. So, we're very pleased with how we improve BMI and even hip waist ratio. Here's some of the results. You take a look. I just randomly picked this out of our star McDougallers. This is expected. This is what you should expect to get. This is not the best case scenario. Okay, if you follow the program, these are the results. Not only will you lose the excess body fat, but you'll look more attractive. You take a look. On the top are the pictures before, and on the bottom of the pictures afterwards, these people. I could have shown you 100 different people that show the same thing, not just the weight loss, not just that they look healthier, but they are more attractive and younger looking. Well, let's take a look at some of the other signs of attractiveness or unattractiveness that people display based upon the food, eating habits, things you can change. Male pattern baldness. I know there are a lot of people out there, because you have particular biases, that's okay, who really appreciate the lack of hair, particularly on men. Not so much on women, but sometimes on women. But when you study it, what you find is that it's not attractive. If you take a general survey of people and you ask, you find that it is not physically attractive or socially attractive. People look older when they're bald. Can you do anything about this? Well, I believe you can, because I believe that diet determines whether or not you're going to lose your hair, particularly for men. And this is based on research and observations. When I was an early practicing doctor, one of my colleagues, I thought as a joke, brought me an article entitled "Can Human Hair Grow Again?" by a Dr. Inaba. I thought he was just poking fun at me. And then I started reading Dr. Inaba's a research paper, and it talked about how when he was living in Japan before and during World War II, there was no male pattern baldness. And then after the war, when the Japanese changed their diet, it became more common. And then he went and explained the hormone changes that took place with dietary change and talked about the testosterone. You know, testosterone is a big deal when it comes to hair loss. In fact, testosterone blockers, Proscar, Propecia, are medications that doctors prescribe to block the activity of testosterone. Well, Dr. Inaba talked about how change in diet resulted in hormone imbalances that set people up for male pattern baldness. Now, I was living in Hawaii at that time, and we took a lot of trips to Waikiki, where you saw many, many older men visiting from Japan. And of course, I had a male practice. I had a practice in Hawaii of many males who were fully westernized. And I took a look at these men coming over here from Japan, the elderly men. And, you know, I didn't find any male pattern baldness. Very rare. Whereas my native population that lived in Hawaii, who followed the Western diet and worse, they were fat, bald, and greasy, just like whites and blacks. So it had nothing to do with race. Anyway, can human hair grow again? Well, Dr. Inaba thinks so. I'm not so sure. But I think you can prevent the loss of hair by following a healthy diet. And that'd be a starch-based diet like they followed in Japan prior to World War II. And still do to some extent. How about another observation related to attractiveness that has to do with diet? And that's acne. Blackheads, whiteheads, greasy skin. You know, for the last 50 years, I've been told that diet has nothing, or acne has nothing to do with diet. There's no cause and effect relationship. Just forget it. And then I took the trouble to look for the research that supported this. I found the study, and there is only one study, that all this is based on. I had 50 years of telling hundreds of thousands of teenagers, don't bother with your diet. Just keep eating the greasy hamburgers and French fries. It won't make any difference. And the suffering that has gone on. This is based on one observational study paid for by the Chocolate Manufacturers Association of America. They paid for it. Yes, they did. Well, what they did is they took 30 adolescents and they counted the number of pimples on their face. And then they fed them either a diet with candy bars, added candy bars, that contained chocolate, or the same candy bars without the chocolate, but they had the same amount of fat. And what they found was that there was no difference. The only thing that was missing was the cocoa, the chocolate. Still high fat, no fiber, acne promoting grease. Anyway, that's what, particularly adolescents for the last 50 years have been plagued with, is dishonesty based upon this particular study. Good book by the Nelson twins. And I had a part to do with this book. It's a book about how to clear your skin up with a good diet. And guess what diet they use? And you can see the authors and the big change that occurred in their particular skin with a change in diet. These girls, by the way, were models. Well, not only do you see greasy skin and acne and baldness, but you also see coloration when you look at a person. I want to talk to you about color here for a few minutes. What is determined by experiments is that people are particularly attracted to certain colors. And that particular color is red and secondarily orange. So anything that makes you appear more red is going to indicate attractiveness for some reasons that we're going to talk about in just a minute. One of the things that you need to know is that peak estrogen levels during your menstrual cycle result in more redness, more facial redness. It occurs at the time when you're ovulating, when you're most likely to get pregnant. Your skin becomes more red. And the way you can change the amount of redness in your skin with your diet is this. The reason that you look gray or blue, in other words, unhealthy, which is the typical American, is because they have a lot of venous blood circulating in their skin, because they have poor circulation. Venous blood is blue, and so you get kind of a bluish discoloration. Whereas if the circulation to the capillaries is vigorous, then red blood cells are more likely to be present. Red blood cells are red. So you can change from a grayish, bluish complexion to a healthier looking complexion. In other words, you can become in the pink. Don't they say you're in the pink? By just changing what you eat and improving the circulation. There's experiments that are done, and I want to share with you about changing circulation based on what you eat. And what we see here on the right is a diagram demonstrating the changes that take place after you eat a high-fat meal. The red blood cells, which you see in the first frame here, are bouncing off each other. They don't stick at all. They're flowing freely, and then you feed the fat. And the red blood cells, they become coated with fat. Now they can no longer repel each other. The natural tendency of a cell is to repel, okay? If you coat it with fat, it can't repel anymore. And so it sticks together. You see the progressive clumping of the blood that occurs, and the blood flow stops. It's completely in some areas of the capillaries. And as a result, you turn blue and gray. Here it is in a video format. You see prior to the meal, the blood cells flowing very rapidly. They're bouncing off each other, great circulation. And then what happens is you feed the fat. And the blood cells, they stick together and they start to clump. And here's what you get. You get something we call in the medical business rouleau formation. Tremendous reduction. You see that in some areas there's no blood flow at all. You can imagine these cells are losing their oxygen, they're turning blue. And this sludging goes on for hours. And finally, maybe 10 hours later, the circulation returns. But unfortunately, most of us, most Americans have one high-fat meal after another 3-4 times a day. You can actually measure the oxygen content of the blood decreasing after a meal by about 5 to 20%. The amount of oxygen in the blood decreases. Well, oxygenated blood is red. Deoxygenated blood is blue. Wrinkling. Now, there's something that people work hard to minimize, to say the least. Well, the research shows that the same hypoxia that's created by poor circulation that I just showed you also causes the skin to be inelastic and to contract together to form all kinds of wrinkles. And well, let's see. What they say in this particular study is a higher intake of green and yellow vegetables was significantly associated with a decrease in Danielle wrinkling score. Intake of saturated fat was inversely associated with wrinkling score. All right, so in other words, the more saturated fat you took in, the more wrinkles you got, because you develop hypoxia. And one of the things I wanted to tell you in the previous slide was that the blood sludging that occurs when this particular person that you saw in the video or in the still slides, this particular person had a diet that was only 67% fat. It was 2 strips of bacon, eggs, butter. It was typical American breakfast. Well, that was with animal fat, but what you need to realize is that vegetable fat, like safflower oil, corn oil, vegetable oil causes the circulation to be more severely sludged and for a longer period of time. Anyway, chronic low blood supply to the skin is fundamental in the formation of wrinkles. which I don't believe can be gotten rid of by changing your diet, but they can certainly be prevented by eating a healthy diet. Wrinkles you associate with sun exposure, and that's true. Sun does have, people out in the sun a lot have more wrinkles, at least some research says so. There are other research that doesn't confirm this, but let's just buy into the idea that excess sunlight is damage to the skin. And I certainly believe it is to some extent. Well, if you eat a healthy diet, you can reverse some of this damage. This is a very important research paper that was published in the New England Journal of Medicine back in 1994. They took people with sun damage in their skin, which is reflected by actinic keratoses, which are little rough areas on your skin, raised up, scaly type areas that eventually can develop into various kinds of skin cancer. Not melanoma, but, localized skin cancer, which is pretty easy to treat. Not very fatal. And this would be basal cell and squamous cell carcinomas. So you start out with these actinic keratoses, which are due to sun exposure. Well, in this particular experiment, what they did is they put people on a low-fat diet. The intention was to go from 38% of the calories as fat to 21% of the calories as fat. Actually, they got down to 30% fat. But still, in the last 10 months, the cancers occurred 10 times less frequently, these actinic keratoses, 10 times less frequently than those on the high-fat diet. So you can prevent the recurrence of lesions due to sun damage with a healthy diet. I could go from the top of your hair to the bottom of the soles of your feet, and I could point out things that the Western diet has done to you to make you less attractive. Some of you may have noticed these, some of you may not have, but next time you look, you'll notice. Hemorrhoids are not attractive, and they're due to the Western diet. Varicose veins, not attractive. To have these little blue worms coursing your legs, not so. Well, both of these are caused by chronic constipation. What happens when you eat a low-fiber diet or a diet with dairy products, which causes constipation, is you have to grunt and groan and strain to move your bowels. Well, that grunting, groaning, strain pushes blood up into your face, and you notice that. Well, it pushes blood into your hemorrhoidal veins, and they get stretched out. Pushes blood into your leg veins, and they get dilated and incompetent, and you get varicose veins. You can see these. These are not attractive. These have to do with your food. This is not a sign of good health. These are we do refer to these as diseases, not health. All right, let's talk about skin color a little bit. I have to begin with lesser primates, various lesser primates. You see a couple of pictures of them up here. And these species of primates are known for the fact that they signal their time of fertility, the time they ovulate, by changes in color of their skin, their face, or their buttocks. It turns red. It becomes very colorful, particularly red. And they flash these big signs: I'm fertile, come mate with me. Amongst other members of their family and their communities and of lesser primates. It's time, folks, I'm red. Well, you don't see that, at least so dramatically, in human females, or do you? Well, maybe if you notice, you will, but maybe not. But certainly this change in color is less dominant in the Homo sapien than it is, say, in monkeys or chimpanzees or other animals. Or no, certainly it's less. Why? Well, one of the theories is that we don't want to signal to our male counterparts that it's time to mate, and that's the only time to mate, is when you change this color in the middle of the month. So the opportunity is for one sexual relationship or a month or a limited number of sexual encounters during a short period of time. This is not acceptable for the human species, I guess. In other words, the fact that you are constantly able to perform the dance sexual intercourse throughout the entire month as a human being is one way of concealing this specific time of fertility, which encourages monogamy. In other words, the man is going to stay with you all month long, not just pick you up when you're fertile. I hope you can follow that explanation. Women's faces do become more attractive. Their colors change, and it's because of hormone changes. Estradiol increases the blood flow to the skin, and estradiol is the hormone that is increased during the time of ovulation. So by increasing the blood flow due to the changes in hormones, you actually do show through a redder color during your time of ovulation as a human being. Red is attractive. Red lipsticks, red clothing makes women more attracted to men. Started using lipstick 10,000 years ago, we know. And as I mentioned, the red flushing that occurs during sexual activity, during the dance, is something that happens during a sexual activity. It's turned a bit red. Red is also the color for winners. If you're going to, your likelihood of winning an athletic event is increased by the color of this jersey you're wearing, red as opposed to blue. And one of the more obvious places, obvious of course, is the red lipstick, but rouge. Why do you think women have the practice of putting rouge on their face to give them a red flush? What do you think they're trying to indicate? An attractiveness. They're showing a color of attractiveness. In this case, it doesn't necessarily have to be timed with the phase of fertility or ovulation, but you can artificially apply a color which is associated with your fertility to become more attractive. Orange is also a color of attractiveness. Orange is associated with better health, and various reptile, fish, and animal species, colors of yellow and orange show strength, immunocompetence, abilities to reproduce. These are very favored colors, and orange is in particularly a favorite color for people. And by the way, to turn orange is pretty easy. You just eat lots of carrots, squash, sweet potatoes, mangoes, cantaloupes, oranges, green beans, and leafy green vegetables. And the pigment, the carotenoids, is accumulated in your skin, and you turn orange. And my dad was a World War II pilot, and one of the things that the men did is they ate buckets of carrots so they could improve their night vision during the battles. And so, he was amongst a whole bunch of orange pilots during World War II. There's an association between smell and color. In this particular experiment, what they found was that when people consumed more carotenoids, not only did their skin turn more orange color, as we just talked about, but when they put them to odor tests, when they smelled them, when they smelled their sweat, what they found was that those who consumed carotenoids had a more pleasant body odor, as you see reflected in this particular graph in front of you. Hedonistic, in other words, pleasure, is associated with yellow coloration. So, anyway, odor and color and food being the common denominator, all things to go together. So let's talk about this other way of distance sensing. Sensing other people from a distance. We talked about vision. Now let's talk about odor. First thing you need to understand is as the recipient, in other words, the one who smells these odors, your ability to smell actually is determined in a large part by what you eat. People on a high animal fat diet, their olfactory senses are diminished. Their ability to smell is diminished. This is an important piece of research to start out with. Is they took subjects and they injected them with a toxin. Lipopolysaccharides is what they're called. And this is a substance that causes people to react like if you've got a terrible infection without becoming actually infected. So that's why they used a substance like this. And they injected these people with this toxin. And then they made observations. And not only did they look at their face, which you see pictures here of the face of people during this experiment, but they smelled their t-shirts and considered their body odor associated with sickness. I'm not talking about diet, I'm talking about sickness. And they found both of these, visual appearances as well as odor, convey your health or your illness. Well, for very important reasons. You don't want to be around sick people for a whole variety of reasons. You don't want to catch their illnesses. And as we've talked about, you don't really want to be around people who are less than ideally functioning. So you communicate diseases, you communicate the fact that you're less productive and you'd be less efficient when it comes to your family and reproductive matters. Just by making somebody sick, by giving them an injected poisoning. This doesn't have anything to do with food, except it also occurs with food. We can detect a whole bunch of diseases based on odor. I think every medical student, every resident has had the experience of seeing enough very ill people to appreciate the fact that there are some characteristic odors that occur with illnesses. For example, diabetics develop ketoacidosis, and they smell like acetone. People with kidney failure, they develop high blood urea nitrogen levels, and they smell. It's a characteristic odor. Same thing with liver failure. It's described as liver stench. In a dead body, there are 800 different chemicals that are able to be detected through the nose when somebody dies. This is one of the most disgusting smells that I've ever experienced. Is an animal that has rotted for 2 or 3 days. The odor is just nauseating. Anyway, there are a whole bunch of other diseases that give off characteristic odors, cancers and infectious diseases and so on. So the nose is very, very important when it comes to diagnosing whether you're healthy or sick. In other words, whether you're attractive or not, the nose. You know this because you've heard news stories about how dogs are used to smell people to detect whether or not they have cancer before any other sign of cancer shows up. And so we've considered this a way to early detect cancers and maybe catch them in time. I have my doubts, but that's the whole idea behind it. And an interesting thing is that in this kind of research of odor and predicting disease and cancers, they don't use dogs as much anymore. They use ants, because ants have such a tremendous ability, such a sense of detecting odors that they're so much more efficient than a dog would be. It takes 30 minutes to train an ant. It takes 12 months to train a dog. Ants are cheap. So they're using ants in some of this detective work, picking up odors. I've noticed this in my own personal life, and maybe if I tell you this story, you'll have noticed it too. In people, when we undergo certain emotional reactions, we will exude odors based upon those reactions. We're going to talk about fertility of bed, but there are other things like self-esteem and anxiety and fear and disgust. I remember one time, and Mary's in my life, when we were flying airplanes. And in the process of getting our twin-engine IFR rating, Mary had to go up with an instructor, and it was a tough time for her. It's one of the most difficult tests you've ever taken, to fly an airplane without any visual outside stimulus. In other words, you're just looking at a bunch of instruments. Anyway, it was a tough hour and a half, 2 hours for her. And I flew the airplane right after her, and I got in the airplane, and the odor of fear was still present in the air. Yeah. We convey even our individual emotions minute by minute through odor. Now, women are particularly good at picking up odors because of the way they're built. If you look at the olfactory bulb, which is the stalk of the brain, and you look at the number of nerve cells that are present in women, human women, they have almost twice as many nerves in their olfactory lobes as men do. So women more heavily rely upon smell to pick their mate, as opposed to men who rely upon vision. Just the nature of the species. Just seems to be the way the genders have been laid out. Women, odor is more important, a clue to the state of mind and readiness. And for men, it is visual. All right. So what happens when a woman ovulates as far as her signals that it's time to mate? I mean, after all, that's one of our primary purposes, is to continue the species. And we only do that because we have these strong desires and these clues and consequences and occurrences that lead us up to this act, this dance of sexual intercourse, which results in reproduction. It's crucial that we do this at the right time in order to have an offspring. And it's crucial you do it with the right person so that you have the most fit offspring. So as you approach ovulation, the body odor changes. So you become more sexually attractive. A woman's voice changes, it becomes more high-pitched. You develop more facial redness, and I've told you this has to do with the changes in estrogen that occur that change the circulation in a woman's skin, so she gets a little red, at the time of ovulation. She will wear more revealing clothes. And a woman is 3 times more likely to wear red or pink at the time of fertility than at other times of the month. Interesting study. Greg Miller, the lap dance study. Oh, this is something that a lot of people have looked at and enjoyed this particular work. So let me share it with you. Gregory Miller, what he did is he hired lap dancers, strippers, people who work in men's clubs. And he asked them during their 5-hour shift, asked them to count the amount of tips that they got, and also to note their menstrual cycle and when they were fertile. And what they found is that when a woman is ovulating, she was able to take an average of $335 during a 5-hour day of dancing. When she was ovulating, $335. During her post-ovulation, she would take in an average $260. And during her menstrual period, the furthest distance from fertility and ovulation, an average of $185. In other words, the difference, the amount of tips she got was $150 based upon when her cycle she danced. And by the way, the average tip, if somebody's just sitting in the audience, is $1 to $5, just in case you're interested in tipping etiquette. And if you get a lap dance, it costs you $14 on average. Let's take a look at this menstrual cycle in some more detail so we can see what we're talking about here. Estrus is the time of receptivity, productivity, selectivity, and attractiveness. It's when you're most fertile, you're most likely to get pregnant, to fulfill your duty as a human being, to carry on the species. What we see is a change in your uterine lining, which is the first reddish, yellow, orangish representation you see down here. You see, as the cycle goes on, you start out with a small amount of endometrium. This reddish bottom area you see here it represents the thickness of the tissue that grows inside your uterus. It's called the endometrium. And as your cycle changes, you grow more endometrium all through the period. And at the end of the period, when you start to bleed, at the end of your cycle, when you start to bleed, the endometrium is shed, which is what you see here at the end. So at the time of ovulation, which is mid-cycle, usually 14 days after the period starts, mid-cycle is when you're fertile and more likely to get pregnant. Of course, it can happen at other times. So, the rhythm method is not all that effective as far as keeping you from being a parent if you don't want to be. So anyway, you ovulate mid-cycle, and that's when things changes. Your odor, your facial redness, your body symmetry, and your voice changes so that you can more readily attract a mate. So you can signal to the mate, it's time to dance. When women are in their estrus, in other words, they're ovulating, they also appreciate men more. Doesn't that make sense? In other words, the body of a man is much more attractive when because of the testosterone that's in men, and the more testosterone a man has, the more attractive he is to her. Obese men have low testosterone levels, not so good. So you lose the obesity, your testosterone goes up. And on low carb diets, if you look at people on low carb diets, their testosterone level, testosterone I'm talking about, not estrogen, their testosterone level is much lower on these diets than somebody who eats the normal Western diet. So being overweight, trying to solve the overweight problem with a low carb, Atkins, keto, carnivore diet, ruins your testosterone. In men, you're less attractive to women, particularly in their fertile period of time. Let's talk about this odor and attraction thing in a little bit more detail. It makes sense if you think about it for a minute, how important odor is when it comes to your emotions and your sexual desires and reproduction and everything that goes on in your life. I mean, industry knows this. That's why the perfume industry is a billion dollar industry. Cover up the smells. Is because they appreciate the odor conveys emotional feelings and reactions. There's a reason for this, and that is that you have chemicals in the air, which are picked up through the nose, and in the nasal cavity, they stimulate little nerve endings. They're called hairs. We refer to them as hairs, nasal hairs or olfactory hairs. So there are these little hairs hanging down into the cavity that you see here, and these little hairs are nerves. When these nerves directly course on back into the brain and directly connect the emotional center of the brain to the nose, to odor. So these nerve fibers, they go from your olfactory chambers up through your brain into the limbic system. And in the limbic system, you deal with sexual cravings, anger, fear, satisfaction from hunger. All kinds of emotions take place here. And this is why odor is such an important thing to convey messages, all kinds of messages. The stinkiest odors, the ones that are most offensive, we're going to talk about now. Sulfur. It's the most repulsive chemical, hydrogen sulfide, the most repulsive chemical human beings come in contact with. We call it rotten eggs. If you ever visited Yellowstone Park, you have sulfur pits. You don't stay there very long. It's pretty noxious. Well, how do you get sulfur? So sulfur is the most extensive or most odoriferous substance. It would be good to avoid it, particularly since it's malodorous. People don't like it. Well, you get sulfur from what you eat. Sulfur is an element. It's neither created or destroyed. It has to come from someplace. So it comes from the food. It doesn't come from the air. It doesn't come from the water. It comes from the food. And so we look at the amount of sulfurs in various foods. We see where we get into trouble. And we find that high protein foods have more protein, which means they have more amino acids. And if they're animal proteins, they have more sulfur-containing amino acids, which break down to hydrogen sulfide, which stinks. So let's compare the hydrogen-containing amino acids in various foods. These are the hydrogen ones. These are the ones that stink so bad that make hydrogen sulfide. The difference in hydrogen sulfide or hydrogen or sulfur-containing amino acids in various foods are the following. Beef gives you 4 times more sulfur-containing amino acids than pinto beans. Same number of calories, same amount of protein, 4 times more sulfur. Eggs, 4 times more than corn. Cheddar cheese, 5 times more than white potatoes. You ever hear of cutting the cheese? Odoriferous. Chicken 7 times more than rice. Tuna 12 times more than sweet potatoes. So if you want to stop stinking, you stop taking in the sulfur. It's neither created or destroyed. It goes someplace and into your body. It goes, and then it comes out. It comes out. The sulfur you eat gets absorbed from the gut into the bloodstream. It circulates through the body. It gets to the lungs, the sulfur does, and you exhale it. So no matter how much you brush your teeth, how much mouthwashes you take, you're not going to get rid of it because it came from deep inside you and it's exhaled from your lungs. So that's why you have halitosis, bad breath. It just won't seem to go away. This sulfur ends up on your skin. That's why you have body odor. And the sulfur ends up at the end of its trip as flatus. Flatus, yeah, gas, biogas, farts. Now, I have to admit, on our program, because it's high fiber, we have more gas. Yeah, we do. Initially, just in about a couple of weeks. Then you won't ever notice it again. But one of the things that I can, in defense, say about our gas is it doesn't smell bad. Not like the gas of somebody who consumes the Western diet. The gas in people who consume the Western diet smells like something died. This stink, this body odor goes every place. It goes into your vaginal secretions, goes into the smell of your ejaculate and your sperm. It's every place because of the sulfur you consume from the animal foods. So you want to change things almost overnight. Well, the mouthwash industries think they've got this all figured out. What they say is that all bad breath comes from sulfur. Yeah, that's what they say in their advertisement. Okay, I'm not going to argue with them. And they have a sulfur mouthwash that breaks down sulfur gases and makes them non-odoriferous. And so as it doesn't destroy the sulfur, it just oxidizes it and makes it not odoriferous. Anyway, so the mouthwash industry clearly knows what I just told you, that it's the sulfur that stinks. They just don't make the extra connection that you need to make practical changes, which is to change your diet. Not going to help. You're not going to cover up the basic smell. So you can take that effort, but it'll still come through. You will still give this underlying message of health or sickness. Health is attractive. You can't make a person healthy by changing their odor, by applying deodorants and mouthwashes and creams, etc. It doesn't work. You have to fix the underlying problem. It's like putting lipstick on a pig. We did a test in the early 2000s when we were at the resort in Santa Rosa, California. I had my dentist, George Snyder, bring us a Hal meter over to test our patients. And so we tested the breath of our patients. The Hal meter measures the amount of sulfur in a person's breath. And what we found is in 7 days on our program, the amount of sulfur in our participants' breath was cut in half in 7 days. There's another stink that I want to make you aware of, and that's the stink of trimethylamine. There's a condition called trimethylaminuria or fish odor syndrome, which is where people can't break down the trimethylamine. And they smell terrible. It's called fish odor syndrome. People who have this, they don't, well, let's just say their friends have to get used to the way they smell because they are quite odoriferous. Well, this trimethylamine comes from substances like choline, lecithin, meat, eggs, dairy, which are things you consume by mouth. And they're animal products. So choline and carnitine, that's the other substance. If you have the right kind of bacteria in your intestinal tract, they will break these substances, the choline and carnitine, down into trimethylamine, which stinks. But if you don't have particular bacteria in your colon, which vegans don't, then you don't make this conversion and you don't produce trimethylamine in your system. So you have to have not only the animal-containing diet, but you have to chronically be an animal food eater to grow bacteria in your intestine that causes conversion. Because vegans don't have these bacteria. They don't create the conversion of carnitine to trimethylamine, which stinks. And if you switch to a vegan diet, a tremendous drop in measurable trimethylamine in the person. Well, the ultimate test. Let's put it to the test. What they did is they had 17 male donors who were tested on a meat or non-meat diet for 2 weeks. And they asked 33 women to smell these men, to smell their sweatshirt, their t-shirts, which they wore, pretty regularly during this period of time, 2 weeks. And what they found is when the men wore their t-shirts during the period of time when they consumed the meat, they were described as less pleasant, less attractive, more intense. Meat stinks. Now, not all sulfurs gives you a malodor. There's some odors from sulfur compounds that are present in plants, which are actually desirable and cause you to have more hedonistic feelings. Hedonism is the pursuit of pleasure and happiness. And so studies have been done on feeding garlic to people to see what happens to their hedonism score, whether they get more pleasure and happiness out of life by consuming sulfur compounds that are so prevalent in garlic and onions and other vegetables. And what they found is actually your enjoyment in life and food and everything is enhanced by consuming the sulfur compounds that are present in plants, which are different than the sulfur compounds that are present in animal foods. This all may have passed by you because you can't relate to what I'm saying. Now, let me explain to you why it's hard to relate to what I'm saying. It's because we ate like everybody else did in the past. My first realization of this came when I was a sugar plantation doctor, and I was taking care of a large population of hippies, vegan hippies. And they didn't have showers, they didn't wash, maybe a dip in the ocean every month or so. And they would come into my office, a small room, easy to pick up the odor from them. And they smelled, but they didn't smell unpleasantly. They just smelled strong from not washing. It was different because I was a meat eater back then. I noticed this, but I didn't notice these odors that came from the people I worked with because they were all meat eaters too. And that happens to go with an important part of our lives, which is sensory adaptation. It's a survival mechanism. What happens is when we initially get confronted with a stimulus, we notice it. And then if it's present for a long period of time, because it hasn't done us any harm, we ignore it. We adapt to that particular stimulus. Like, for example, if there was a lawnmower outside the window right now, you might notice it when you walk in the room, but after a few minutes, it disappears. You go to somebody's house, you notice the odor of their home when you walk in the first time, maybe the second time, but not afterwards. You adapt. It's like when you walk into somebody's home at Christmas time or Thanksgiving time, there are certain odors because of what's going on at that particular time that you recognize immediately, but quickly you adapt to these stimuli being non-threatening, not dangerous. And so you can get them out of your mind so that new stimuli, which could potentially be dangerous, will be recognized. So the reason you don't smell the malodorous of the people around you is because everybody smells the same. Which is not good, which you can't cover up, which results in people getting messages about you being healthy or unhealthy. In other words, still the message of attractiveness comes through, even though there's a sensory adaptation that takes place. The body's still out there to protect itself, to take as many advantages as possible in lives. All right, let's go on to hearing. Okay, there are three distance sense needs that we have. You can distance sense, in other words, we're far away, sense what's going on. There's vision and smell and hearing. So as the recipient, you need to have good hearing, right? To appreciate the changes that take place that would indicate attractiveness, for example. You need to have good hearing. Hearing loss was discovered when people noticed that parts of the world where people had a lot of heart attacks, they also had hearing loss problems. They had problems with their inner ears, which cause dizziness, tinnitus, ringing in the ears, and loss of hearing. And about in the 1960s, investigator by the name of Rosin went and studied a tribe of people in Southeast Sudan, the Maban tribe. And what he discovered was some things that were very interesting about these people. They were essentially in the same health when they got to be 75 as they were when they were 15. No heart attacks in this population of people. They had very little atherosclerosis, even when you examine them by autopsy. They had greater elasticity of the arteries. They had no deep vein thrombosis or pulmonary embolus. Deadly problems. No duodenal ulcers or ulcerative colitis. None. They were well nourished. Their posture was erect at all ages. No obesity. They seemed to grow more slowly and live longer, and they remained agile into their 70s and 80s. But, and this is on a frugal diet. This is on a diet of millet primarily. Very little fish, not much at all. Nuts, dates, a few vegetables here and there. They possessed a few scrawny cattle, a few pigs and goats that were never slaughtered. Rosin was interested in their hearing because he was an ear, nose, and throat doctor. And so he measured the hearing, and what you find are the two charts here, one of the Malbans and one of people in the United States, Western Europeans, Australia, any part of the Western world. And what you see is a change in ability to hear as age advances. And you see a progressive hearing loss that occurs in people on the Western diet. Compared to these folks in Southeast Sudan who went through life with normal hearing or extremely little loss. And the other diseases associated with Western living, including heart attacks, etc. Work was extended by a fellow named Spencer. Spencer is an otolaryngologist. He got into trouble. He found all this data by Rosin and participated in some of the research. And Spencer, James Spencer, he got sick. He got terrible vertigo, and he couldn't work. He kind of fell down on his office floor and couldn't get up. And he thought about this research, this connection between inner ear disease and diet that he'd been learning about. And he decided to change his patient practice. Well, first he cured himself by going on a low-fat, low-cholesterol diet, a few of the medications that were available at that time. So they weren't very effective medicines. Anyway, he cured himself, and then he took the next 414 patients that he saw, and he put them on a healthy diet. And he found half of them had high-frequency hearing loss, and studied them for several years. And what he found is those who successfully changed their diet, 80% of them got relief of vertigo, dizziness. And 90% got improvement in their hearing. Maybe not fully back to normal, but improvement in their hearing by changing their diet. Tinnitus went away in about half the cases. I've seen that too. What happens here, the reason you run into trouble with hearing is because, and balance and ringing in the ears, is because there's one artery that supplies this particular organ. And that artery gets plugged up through years of eating an unhealthy diet, as you see on the left, as you have progressive closure of the arteries. And so you get gradual hearing loss, but it also can occur because of sudden rupture of a plaque. And I've had patients and actually friends who've lost one ear, hearing in one ear all of a sudden from ruptured plaque because this artery gets closed down. Or you also see a diminishing of hearing related to the compromise in blood flow that we talked about, the decrease in oxygen content by 20%. In other words, you have a compromised circulation to your inner ear, and as a result, you have malfunction. On our diet, we effectively lower cholesterol. And as I say, I see similar things in my patient population, particularly the ringing in the ears and the balance problems. We don't measure hearing. But we have a very effective program for treating these particular problems. And that's a program that dramatically reduces blood cholesterol. I mean, you see the results of the program based upon a dramatic reduction in blood cholesterol. It's not the cholesterol that's the problem. It's just an indicator that we've improved the problem. And you so see that we do this very effectively with food alone. So having an unhealthy diet affects your voice, not only because you're dealing with circulation issues to the voice box, but because your voice quality depends upon your ability to hear. You may have noticed that people who have problems with deafness have problems with their speech. And so whether or not you convey a healthy speech to somebody, what they're used to, depends upon your ability to hear, whether or not your voice is doing what it ought to do. Well, we know that the pitch of sound changes based upon how you eat and whether or not you're fertile or whether or not you're a man or a woman. So a woman's voice pitches increases intensity during their fertile days, and a man, his pitch is lower in octaves. And this lower pitch indicates strength and competitiveness. That's one of the qualities that men would want to have. The higher pitch, there are explanations for that in the woman who, during her fertile time, changes her voice. When it comes to men, it's the testosterone that lowers the pitch, and you end up with a lower amount of testosterone in your body if you're obese or you go on one of these low-carb diets. When it comes to discrimination, we have laws that prevent us from discriminating for things like sex and gender, marital status, family status, religion, color, race, ethnicity, politics, etc. All these rules that you can't discriminate. But ladies and gentlemen, there's no rule against discriminating based upon appearance. Nobody's going to save you. You're going to have to save yourself. And the way you improve your appearance, your attractiveness, your health is simply by fixing the problem. The problems of food. I hope you now understand the importance of eating well in other aspects of your life, your business and your family life and your reproductive purposes and so on. This all ties together with food, but it ought to. I mean, every thing ties together with your health. why wouldn't your, this particularly important area in life, your attractiveness to other people, share the same type of consequences based upon the decisions you make at the dinner table? All makes sense to me. All right, Heather, if you have any questions for people.
Thank you. That was great. I learned a lot.
Well, Heather, you've never heard that talk before, and nobody has. So
I know, and you didn't talk about anything too embarrassing. I was worried.
I have to think the problem. I remember I did this presentation initially in June of 2022, and I think that it had sex in the title. You know, the father-daughter relationship prevented her from wanting to hear this talk. So it wasn't too embarrassing.
It was great. Thank you so much. I don't think there's any questions, just lots of wonderful comments in the chat, people just giving great thanks to you and how much they learned during this talk. So we really appreciate you and your time, Dr. McDougall, Dad.
All right. Well, I've said a lot. I've pretty much conveyed everything I want to share with you, and I hope you've enjoyed it. And I hope you'll take the time and effort to share with other people. You know, we've got a world to change, to save, and we'll do it one person at a time. And in addition to helping you as individuals, as patients, we also have another purpose. We'd like to see planet Earth survive, and we'd like to see a more peaceful, enjoyable planet. And everybody has a part in that. Now that once you know, you have the responsibility of doing something. You now know. So.
And we all want to look and feel our best. So thank you for all the advice.
All right. Okay, thank you very much. Bye-bye.
Thanks everyone for tuning in. This recording will also be available on our YouTube channel. So enjoy the rest of your day. See you next Sunday. Bye.
Bye-bye.